Governor Baker is announcing a new statewide COVID-19 public awareness campaign. Let's listen in.
COVID-19 cases. Yesterday, the Department of Public Health's daily report indicated that there were over 110,000 molecular tests reported. 2,721 cases were confirmed. The 7-day average for the positivity rate is just over 3%. 110,000 tests reported in a single day is obviously a huge number, and we continue to be a national leader in access to testing. Currently in Massachusetts, there are 893 confirmed COVID patients in the hospital. That's down from where it was at the end of last week, and 192 are in the ICU. We're also moving ahead to stand up a field hospital, which we talked about last week, to assist our healthcare system in Worcester, and that work is moving ahead as planned at the DCU. Before I talk about the public awareness campaign, I do want to reiterate some of the things we've said about Thanksgiving. I don't think it's any surprise or any secret to anyone who's been turning on the TV, reading the papers, listening to the radio, or paying attention to any of the commentary, observations, and news about COVID and Thanksgiving. Thanksgiving clearly represents a big potential risk for the spread of COVID-19, similar to the risk that it was in Canada back in October. It's no secret that we're in the middle of a second surge, and yes, there is clearly hope on the horizon with all the positive news about vaccines, but I think everybody in the public health space agrees that Thanksgiving and the holiday season generally need to be different than they've been in the past, and everybody has a role to play in helping us work our way through it. I just want to start by urging everyone to celebrate with members of your household and avoid any group get-togethers that you would normally do in a traditional year. If you do anything more than that, you really ought to wear a mask and keep it short, and hope that they wear a mask too. Be sure to observe the state's indoor gathering limit of 10 people. College students that are returning home need to get tested before they leave, and if they test positive, they need to quarantine. This is not just here in Massachusetts. This is a rule that's been adopted pretty much across the country by most states and by most colleges and universities. Don't share food or drink, and if necessary, open windows to allow for ventilation. And I'm going to repeat something that I've said many times before. Older people and those with pre-existing conditions, these are the people most at risk of serious illness or death from COVID. Please think about how your actions affect your elderly relatives or those friends or neighbors or relatives of yours who have pre-existing conditions. If you plan to spend time with these folks, please take the proper precautions. Wear a mask, distance, and keep your visit short. The bottom line here is to do everything you can to keep it small. I know that sounds harsh, and it runs counter to traditions and habits that we've all pursued around holiday season over the course of many, many years. But try to think about the fact that small can be intimate and just as special as larger gatherings. And larger gatherings are simply not worth the risk to you or your loved ones. The data on this one's pretty clear. Spending a lot of time indoors with many family and friends is exactly how the virus spreads. The biggest single driver of the spread in COVID-19 in Massachusetts these days is household spread. Big gatherings for long periods of time indoors during this holiday season, people being familiar and casual with people they're familiar with, is exactly the type of thing that will spread the virus. And we should all remember, and we've said this before too, that there are many people who are in fact contagious and who can spread the virus, but whose symptoms will either be non-existent or relatively slight. They may think they just have allergies, they may think they have a cold, but in fact, they have COVID. And that's one of the reasons why we've been so aggressive about building out our testing capacity. And I think no one wants to be the person who's responsible for getting a family member sick. So please, do what you can to avoid that risk altogether.